Okay, so for our next two measurements we're going to discuss, we're going to look at torque relative to position, so the kinematics of the movement. And these are the angle of peak torque here and torque at 30 degrees of knee flexion. So I want to talk about this value first, the torque at the 30 degrees of knee flexion. So the relevance of this measurement is to try and increase the external validity, so the applicability of your results to real world scenarios. And this 30 degrees of knee flexion has some wider relevance. So for example, depending on your speed and obviously your technique, it is the typical knee flexion angle that you will contact the ground with when running or sprinting. It is also the knee flexion angle at which individuals suffering with conditions such as patellofemoral pain syndrome will experience that discomfort, which is something I can attest to firsthand. So really this is simply saying what is the peak torque at this degree of knee flexion, and it is more relevant, I should point out, for the knee extensors, he says, trying to highlight that area rather poorly, than it is the knee flexors. So when interpreting this value, you're going to want to focus more on the knee extensors. And because this is a dynamic value in terms of relating it to running, you are going to want to pay more attention to this value at higher angular velocities, so the 360 degrees per second. However, the relevance to patellofemoral pain syndrome, you are going to be more interested in this value at lower angular velocities, so nearer the 60 degrees per second test. So we do have a deficit here above the norm of 10%, so this is noteworthy and you could interpret that as such. So again, it might be worth looking into and comparing this with the angle of peak torque. So the angle of peak torque here occurs at a, whoops, don't want to highlight everything, at a similar position, so only 4 and 5 degrees from this optimal angle here. So that also warrants comparison. So if you had the angle of peak torque occurring at the same position, which it more or less is, that also gives you a further discussion point. Angle of peak torque is very much dependent on the speed of the test, or sorry, I should say the angular velocity of the test. So whilst you might read slight variations from this to give you some normalized values in terms of extensor torque, when looking at 60 degrees per second, so the slower test, the angle of peak torque is around about the 54-55 degree mark. This is for the quadriceps. For the 180 degrees per second test, that angle moves to nearer extension, so that's around about 45 degrees per second, 45 degrees extension or flexion. And for this test, the 360 degrees per second, we would expect to see that angle of peak torque nearer 35 degrees of knee flexion. So what this test is telling us is that peak torque is occurring at a greater extension, and consistently so. So between both limbs, there's a degree difference between the two. So this is telling us that this is the peak torque at this speed is occurring later than it should do. It should be nearer the peak torque at 30 degrees. It should be nearer the 35 degree mark at this particular angular velocity. So that's occurring a little bit later than it should do. For flexion, the angle of peak torque for 60 degrees per second is around about 35 degrees of flexion, and 180 degrees you would expect to see that shift to around about 43 to 45 degrees of flexion. And at this particular angular velocity, 360 degrees per second, peak torque should occur around about 54 degrees of knee flexion. So on the right hand side here, that's almost spot on. You couldn't ask for that being any better. But on the left hand side, we see that that's happening significantly later. So this is beyond, this is occurring almost spot on. This is atrocious on the left hand side here. There's a real functional deficit here. So this point here at the knee flexion would definitely warrant consideration. So you've got peak torque occurring at two very distinct regions, and on the left side it's happening when the knee is almost at the full range of motion. So the range of motion you can see is 102.5 degrees on this leg, and this is occurring at 106. So that's the range of motion. That's not a position, by the way. That is the full. So from start to finish, we're saying that that's how much range of motion the test moved through for the left leg, and this is a positional measurement here. The angle of peak torque occurred at 116 degrees of flexion. So that is certainly something that warrants consideration. Whilst we're here, I just also want to mention, because it doesn't really warrant its own video, the coefficient of variance. Now this measurement is essentially a score of the validity of your results. So the variation that has occurred between the repetitions in terms of the duration and the magnitude of the torque. So really, the lower the value you get here, the better. This is the reason we have a familiarization session, because someone who's never performed this test before will have a much higher coefficient of variance. These values are actually pretty good, really. I mean, ideally you would want them to be in single digits, but they're not far off. So this suggests that each repetition was performed consistently. There are other factors that can influence this. So the more repetitions you perform, obviously the greater the variation you're going to get between those repetitions. So if you're performing a fatiguing protocol where you have 20 plus repetitions being performed, then obviously your coefficient of variance is going to potentially be higher. Pain, discomfort, injury are all factors that are going to influence this, and this is information you will get from your participant at the beginning. You ask, is any limb injured? Are you healthy? Are you fit? Are you having this test conducted for a reason? Are you recovering from an injury? Things like that. But also a learning effect, and there are cases where, or I've heard of, not experienced them myself, where people have tried to skew the results if they're trying to mask an injury, but it's not something that you would need to worry about for the sake of your assessment.